Hello, my name is Paul Leong. I'm a facial plastic surgeon in Pittsburgh, Pennsylvania. I wanted to produce this short video explaining at least one portion of the facelift incision and what the various choices are when you make this, what we call the temporal portion of the facelift incision. So, when patients come in, quite naturally, quite understandably, they have a desire to know, well, geez, where are you going to make the incisions and what are the pros and cons? And I'm often surprised, even if they've gone for a couple consults, or sometimes even they've had a prior facelift, and they don't really understand what are the pros and cons on making incisions. So focusing first on this area, I'll cover other areas of the facelift incision in separate videos. So what we have here is the so-called temporal portion of the facelift incision, and so this is the area that kind of curves into this area of the face. Fundamentally, there are two choices. Traditionally, facelift surgeons for many, many decades, even generations, have made this portion of the incision straight up from this portion of the ear, almost straight up into the hair like this. Certainly there was a very reasonable goal here. They're trying to hide the incision within the hair-bearing skin such that you can't see it afterwards. But there's an important disadvantage of this that patients should be aware of. When you make the incision in this area, and then especially if you have a fair amount of excess skin to remove, which obviously we don't have on this lady, when you move the skin back like this, if the incision is back here, then you move the sideburn with it. And what you can often see in patients who have had facelift, if the sideburn, is that the sideburn doesn't start here, it starts way up here. And this is to be avoided at all costs, because this is a clear indication that somebody's had a facelift. And so when you weigh that, there is the other option, which is, as you can see I've drawn here, this is a temporal incision that hugs the edge of the hairline. I've drawn it just a little bit beyond the hairline so you can see it in this video, but in the basic concept, it's right on the edge of the hairline. And if you close this carefully, you don't see this incision. It has one very significant advantage, which is when you move the skin up like this, when you do a facelift, you obviously do not move the hairline in any way. The hairline stays exactly where it is. You don't shift the sideburn up. So when I see a patient for a facelift and I choose between these two different options, hugging the hairline and going up into the hair, the most important two things to look at are, number one, how does her sideburn look? Some people have a nice robust sideburn and you can move it a bit and it's fine. And in that case, you can potentially try to hide the incision in the hairline. On the other hand, some people's sideburn is already a little bit high or a little bit thin. And the other very important, the second very important variable is how much skin needs to be moved. Even if you have a nice, robust sideburn, if you know that you're going to have to move a fair amount of skin in order to get a good result, you're going to shift the sideburn. And in that case, you very much should opt for this incision that hugs along the hairline. So those are the pros and cons of the two incisions, and I hope that's helpful for you as you consider your different options for facelifting. Thanks very much.